excited that we're able to talk about our new program tonight. We have Erin Lipka, our manager for our pulmonary program, and she's the leader of our cardiac rehab and pulmonary rehab programs. Previously, people had to drive a long way, over an hour, typically to get to a program. And I'm just really excited that we have it here. And I'm going to turn the program over to Erin.
Hello, I'm Erin Lipka. Just a little history about myself. I've been here at McKenzie for 11 years. I am a registered respiratory therapist, and I am the manager of Cardiopulmonary, the department here in the hospital. What we do in Cardiopulmonary, it's all about the heart and lungs. So that's basically what I'm going to be talking to you about today. If you haven't seen us, we usually are the ones that are taking care of you in the ER, doing the EKGs or breathing treatments. We also see you guys as like outpatients if you have to get a stress test. But what I'm talking about today is two new programs that we just started last year. One was the cardiac program, which we started in August, and the other one is pulmonary rehab that we started in November. So since we started, we've gotten a lot of patients. I'm really happy that we're able to provide this for our community, because before, like she was saying, they'd have to drive an hour to the nearest cardiac or pulmonary rehab. And people just weren't sticking with it because you have to go like 2 or 3 days a week, and that's a lot. And some people don't drive. So the first one I'm going to talk about today is cardiac rehab. My controller wants to work. So what is cardiac rehab? Cardiac rehab doesn't change your past, but it can help you to improve your heart's future. It's a medically supervised program designed to help improve your cardiovascular health if you have experienced a heart attack, heart failure, angioplasty, or heart surgery. So if you've had anything that caused, like a situation that was with your heart, you can be a candidate for cardiac rehab. What it basically consists of is exercise and education. So what does it provide? So exercise counseling and training. Exercise is going to get your heart pumping and your entire cardiovascular system working. You'll learn how to get your body moving in ways that promotes a healthy heart. Education for the healthy heart living, managing your risk factors, choosing good nutrition, quitting smoking, the bad habits that cause you to have those symptoms, education about your heart. And then we also are going to provide you with counseling to reduce your stress, because stress hurts your heart, and a lot of people are stressed, and that causes the heart problems. This is a big part of rehab, and we can help you to identify and tackle your everyday source of stress. Why is it important? Well, there's been a lot of research that has found that cardiac rehab programs can reduce your risk of death from heart disease and also reduce your risk of future problems. So we want to be able to take care of you so you're not continuing to come back into the ER and have the same problems. Oops, I skipped one. The goals and objectives. So our goal is to help you regain your strength, because after you have heart surgery, you're not back to doing what you were doing before. Prevent your conditioning from getting worse. We want to reduce your risk of future health problems. We don't want you back here, having another heart attack. Improve your health and your quality of life. Our objectives is to teach you how to control your symptoms, restore your functional capabilities, and to teach patients how to achieve their optimal capability to carry out their activities or daily living. So who does it help? So people who have had any heart attack, coronary artery disease, heart failure, bypass surgeries, stenting, or any heart valve repair, you guys would be a candidate for cardiac rehab. Oops. So what can you expect? So the first stages of cardiac rehab program usually last about 3 months. So when you guys come in here, we offer it 3 days a week. It's on Tuesday, Thursdays, and Fridays. And it consists of 36 sessions. By sessions, I mean visits. So you be coming here as an outpatient 36 times. Each session lasts about an hour. So the hour is broken down to 30 to 40 minutes of exercising. And then we also do 5 minutes of warm up and cool down. During that hour, you'll be exercising on 3 to 4 exercise equipment. Usually we try to figure out what is tailored to you. If you're able to do the 4, then we put you on the 4. If not, we start you off with 3. And then what our goal is to work you towards completing 10 minutes on each equipment. That would get your 40 minutes of exercise. So it's important that we have you do warm up and cool down. So when you come in, what we do is we'll make sure to get your vitals. We hook you up to a monitor. You will be on a monitor so we can see what's going on with your heart the whole time you're in there. And then we make sure that we're monitoring your blood pressure and your SpO2 while you're in the room the whole entire time. And then the exercise equipment consists of a treadmill, a new step, a stationary bike, and the upper body ergometer. So what the treadmill's purpose is to help you regain strength in your lower extremities, to rebuild your legs. So it allows patients to improve their distance of walking and allow them to build towards walking farther distances. So I know a lot of people that come into cardiac rehab, they're like, I can't walk anymore. I want to go to Walmart and I can't get to that door. So I have to rely on people to wheelchair, to get me to Walmart. I can't walk around and do my grocery shopping. So what our goal is to get them to where they can go back to the grocery store and they can do the things that they were doing before. So this type of equipment helps them.
Those are small steps, but they're giant mountains.
Right.
I mean, that is enormous in a person's life to
Be dependent on,
Yeah, I mean, to get around Walmart on your own is everything.
Right. And then the new step is kind of like a stepper and a bike combined. It allows for full body workout. So basically what it's doing is it's working out your upper arms and your lower legs at the same time. And then the stationary bike, it's kind of like the treadmill. The only thing is that some people have a difficulty walking standing up. So this will allow you to get your lower workout while sitting on the bike. And then the upper body urometer, it's like an exercise individual for limited lower body function. So people that aren't able to go on the treadmill, they can spend more time on this. And it allows uses of small muscle groups and strengthening of your chest muscles following open heart surgery. This is one of the biggest things that we've had found, because after you have surgery, you obviously are getting cut open, so you lose that strength that you had before. This really helps to rebuild that strength. So cardiac rehab includes medical evaluation. So what you do is you'll come in, we'll do an initial evaluation. We'll check your physical and medical abilities. At this point, we're going to have you come in, or we're going to figure out where you're at on the equipment. So we're going to set your settings for you. We're going to set your level, get you ready and prepared for starting the cardiac rehab exercising. Physical activity, rehab improves your cardiovascular health through physical activity. The healthcare team will demonstrate proper exercising techniques. We'll go over the warm up and cool down exercises. Patient will exercise 2 to 3 times a week for 30 minutes to up to an hour while being monitored. Most insurance companies will cover those 36 sessions. And what we mean by monitor is that you will have a respiratory therapist in there, and we also have our medical director come in. He comes in every other week. He comes in, checks on you, asks you questions. If you have questions, you can talk to him about your health. He helps to take care of you too. It's a whole group thing.
Who is that?
That is Dr. Sams. And then our lifestyle education will support an educational offer for healthy lifestyle changes, such as nutrition options, healthy diet, smoking cessation, and maintaining a healthy weight. So you can meet with our dietitian, talk about a weight plan for you. I know some of our patients have done that because they just can't lose the weight. So we can give you the resources to help you stay healthy. Support, feeling depressed or anxious about your current health situation is a normal feeling, and a lot of people go through this. This program is designed to offer counseling and ways to cope with your depression, anxiety, and stress management. This is one of the biggest things that I'm seeing. We actually had a patient come in, and he was having a lot of pain from being cut where his incision was, and he thought he was going through this alone. He didn't think that anybody else was having this problem. When he came in, he got support from the other people that were in the program, that he was able to talk about his experience and what he was going through and how he wasn't able to do the things that he was doing before. And really, these two guys helped each other through, this program, Because one of the guys, he works on like building bikes and everything, and the other guy, he's like a big farmer. So he wasn't able to get out there and do all the farm work, you know, that he was used to doing. So it's really a big support, and we also can help you too and get you back to where you want to be. And so the education, this is pretty much the breakdown of what we go over. You know, if you smoke, we want to get you to stop smoking. Medication, we make sure that you're following your medication. Stress management to help you get through that. Physical activity, healthy eating. Another thing that I didn't mention on here is your blood pressure. We've had a couple of patients that have come in here into our program and they don't realize that their blood pressure is too high. So we're monitoring your blood pressure. So we have actually reached out, got them back with their primary doctor to maintain their blood pressure so that they're taking the medication that's appropriate for them so that they can have a better blood pressure than having it too high. We don't want them to get in the ER and have a condition where they can end up having a stroke or anything else. So what are the results? As you become stronger, both physically and emotionally, you will learn to manage your condition along with new diet and exercise habits. The results are based largely upon each patient themselves. The more dedicated, the better success rate, and that is a true statement. The more you keep coming, the better you're going to be doing. You know, don't give up. Once you start, keep going at it. This is a long-term maintenance program. After about 3 months, you will need to continue these habits at home or your local gym. We also provide you those resources. We have a gym here in Sandusky that we can hook you up with, Taylor Hutchison's gym. We give you those resources so that you can keep continuing being healthy and getting the exercise. Over long term, you may gain strength, learn healthy, heart-healthy behaviors such as regular exercise and a healthy diet. You cut your bad habits such as smoking. You can start managing your own weight, find ways to manage your stress, learn how to cope with your heart disease, and decrease your risk of heart conditions. That's our goal for you guys. So cardiac rehab is a team effort. You don't need to face diseases alone. Cardiac rehab, you know, is medically supervised program in which your partner will, with your care team, plus family and friends to take charge of your choices, lifestyle, and habits that affect your heart. So you guys have the resources to come in here and have the people that can help you, you know, move forward and be healthy. One of the things that I wanted to show, and it's kind of hard to hear, but I was asked to speak today and a couple weeks ago, and I was sitting at home, and all of a sudden I seen this come up on my TV, and I'm like, oh my gosh, I got to record this because this is totally what I'm trying to say. So it's just about a 46-second video.
We're not taking advantage of those benefits. Yeah, this came out of a new government study that basically showed very few older adults are taking advantage and participating in cardiac rehab after they've had a heart attack. So researchers looked at over 360,000 Medicare patients who were eligible for outpatient cardiac rehab. Just 25% participated in a program, and only a quarter of those patients completed all the recommended sessions. Women, elderly, and non-white patients were the least likely to participate in cardiac rehab. But the big picture here is, particularly in the case of Medicare beneficiaries, this is a covered service that many people are simply missing out on. Taken seriously. Exactly, and it really makes good sense because you can get back to activity quicker and safer.
So that's such a true statement, because the thing is that one of the people, like what most people are going through, is that they can't do the things that they were doing before. They can't do the dishes. They can't go out and work in their garden, and they're depressed because they can't do it. So that's the goal of cardiac rehab, is that we want to be able to get you in here, get you back to being the way that you used to be, and be able to do the things that you used to do. The other rehab program is for pulmonary. Does anybody have any questions about cardiac before I move into pulmonary? No? Okay. So pulmonary rehab, like I said, we started this in November. And what is... Yes, go ahead.
Cardiac question.
Yes.
Slow on the uptake. Do cardiologists regularly recommend cardio rehab? Why are so many seniors not taking advantage? What's your take on that?
So yes, a lot of our referrals do come from the cardiologist as well. I think the reason why is because I don't think the patients really know what the program consists of. So I know just from us getting the referrals in our department, and we're calling the patients and we're saying, hey, you know, we got an order and we want to follow up to set up, they don't even know what it is. So they get kind of hesitant about it because they're scared to start something that they don't know. So that's why we do initial evaluation days where they come in, we sit with you for an hour to an hour and a half. Yep.
One-on-one?
One-on-one. And we sit with you for an hour to an hour and a half, whatever we need to do, and we basically go over everything that the program consists of. And then after that, they get to make the decision whether or not they want to do it or not. And I think that a lot of them, they say, well, my doctor said I want you to do this, but then they don't know what it is. And so they're real hesitant about it. And also because they hear, oh, you want me to go do something 2 to 3 days a week, I don't have time for that. So that's another thing too that we've been getting a lot of feedback about, and why they don't do it.
Thank you.
You're welcome. So what is pulmonary rehab? So pulmonary rehab is a customized outpatient program for exercise and education. So it's the same thing as cardiac rehab. You're going to be coming in, exercising, and we're going to be giving you the education to move forward with what what has occurred to you. It is designed to help you improve your lungs after symptomatic chronic airflow diseases. So with pulmonary, there's more diagnoses that can cover you to actually get into the program, unlike cardiac. You don't actually have to have like a procedure or surgery. You could just have like long chronic COPD or asthma to be a candidate to come into pulmonary rehab. So what the pulmonary rehab program includes is a monitored supervised exercise, education about your pulmonary condition, control of your symptoms, medications, and oxygen. We also are going to give you the medical evaluation of treatment, deal with your stress reduction and management of technique sessions, dietary counseling and nutrition guidance, just like cardiac rehab, exercising counseling and training. Exercise increases your ventilation and perfusion to meet your body demands. We'll be doing training of respiratory related muscles and can improve your exercise tolerance and oxygen. So what we can do is we can teach you breathing techniques to help you manage your shortness of breath. We can provide you education where combined with smoking cessation, proper medication use. Pulmonary rehab offers the best treatment option for patients who are having symptoms with their pulmonary diseases. A lot of times it's just you're not using the correct medication. So we can teach you with that. Some people are using their long-acting inhalers instead of using their emergency inhalers. So they're having the shortness of breath, but they don't know what inhaler to use to stop it. So teaching you about that type of stuff can help you improve your shortness of breath. Our education consists of education, exercising conditioning, breathing techniques, getting you the nutritional counseling, and obviously the support of others to get through this. Our goals and objectives is to improve your lung function, decrease your symptoms and shortness of breath, because we want you to be able to do the things you were doing before. Improve your energy, strength, and endurance. That's like one of the #1 goals, is that people are saying, I don't have enough energy. I can't breathe to get up, to go from here to there. We want to be able to give you that. Get that back so that you can get from there to there. You can get up out of your chair. We want to give you greater knowledge of your oxygen equipment and your pulmonary medications, reduce your anxiety and improve your self-reliance. We want to reduce your need for ER visits and hospital stays, and we want you to return to work. And I think that's one of the biggest things, is that people are having issues that they don't feel healthy enough so they can go back to work, and they want to go back to work. They don't want to be stuck to the house. We can get you better engaged in your daily activities and improve your quality of life. Our objectives are to control and alleviate your symptoms associated with your lung impairment. We want to restore your functional capabilities. We want to teach you breathing techniques, airway clearance, and develop stress management for relaxation techniques. This is really important because when you can't breathe, what happens? You get stressed. And when you get stressed, it makes it even more difficult for you to breathe. So we want to be able to teach you how to manage that. I know I was diagnosed with asthma when I was 30, and for the first year, every time I'd have an asthma attack, I would panic because I can't breathe, and what did it do? It ended up in ER every single time because I would get worse. So we want to teach you how to deal with it. We don't want you to go to ER. We want you to be able to manage it at home. And then with airway clearance is a lot of times we want you to recognize those signs and symptoms before you get sick so that you can prevent having to come into ER and get treatment that you don't need if you can just catch it quickly and see your doctor before. Teaching patients how to achieve their optimal capability to carry out activities, and we want to be able to create a personalized plan to help you maintain your general health and wellness. So who does it help? Like I said, it helps a lot. What we're looking at is your obstructive diseases, so your basic COPDs, your asthma, bronchiectasis, your cystic fibrosis, but it also will help people that have restrictive diseases. So your interstitial fibrosis, your occupational environment, lung diseases, people that work in factories, etc. And then it also can help people with other conditions such as lung cancer or pulmonary hypertension or any type of surgery, lung transplant. When I was in college, I got to work at a pulmonary rehab for a couple months. And you would be amazed at how many people come to pulmonary rehab because they have to have lung transplants. And when I went there, I didn't realize that these people that do this and they get their lung transplant, after 5 years, guess what? They're right back getting another lung transplant because they don't last that long. So these individuals really, get together, and the support of each other gets them through this to keep going and keep getting, the lung transplants that they need. And they don't give up, and that's our purpose. So what can you expect? Pulmonary rehab program generally lasts about 3 months, just like cardiac rehab. The only difference is instead of you guys coming 3 days a week, you would come 2 days a week. And we offer that here on Mondays and Wednesdays. It consists of 36 sessions, which is 36 visits that you would come to as an outpatient. And just like cardiac rehab, it lasts about an hour. We want to get you 30 to 40 minutes of exercising and also include with the 5-minute warm-up and cool downs. And then during that hour, you'll be exercising on 3 to 4 exercise equipments. The difference with cardiac and pulmonary is that because of the shortness of breath, people come in and they think, oh man, I should be able to get on all 4 of those exercises and be able to do 10 minutes right away. But they can't. So a lot of them come in and our goal is to get you to 3 pieces of equipment, and if we can get you to at least 3 minutes, we're gonna start working towards getting you to those 10 minutes. So at the end, we wanna make sure that you are able to improve your endurance and your workload on each equipment. And it's amazing because what we do is we have you walk the hallways and we measure the distance of how much you walk when you first come in. And then on graduation, we have you do it again, and you can actually see how well you improved. It's really a cool thing. Because sometimes you don't believe it until you see it, right? So the exercise equipment is the same. We use the treadmill, new step, and the stationary bike, and the upper ergometer. And then over time, it'll help you to do more things that you enjoy. So you'll be able to improve your strength, be more independent, complete daily activities such as your household tasks with less shortness of breath. You'll be able to manage your symptoms, quit smoking, and set and meet realistic goals. And I think that's important because I know so many of the patients that come in and they're like, I have these goals, but I don't know where to start. And then I try to do it and then I can't complete them. So we can help you with that. Sometimes it's just the little goals that we have to work on and build towards the bigger goals, So the summary is pulmonary rehab offers the best option for patients with symptomatic chronic airflow diseases. It doesn't reverse or stop the progression of the disease. However, reducing your symptoms can benefit your overall health and improve your quality of life. And then at the end, I basically wanted to let you guys know that let us help you. So if you know somebody, or if you or any of your family or friends have somebody that just had anything done, heart-related or lung-related, and they're coughing, they're short of breath, and they just can't do the things that they used to do before, and they're saying, I need help, then have them talk to their doctor to see if they're a good candidate for either one of these programs. Does anybody have any questions or anything? No?
I know one day I met a participant, and she was walking down the hallway. She said, this pulmonary rehab is really helping me. I'm so happy you have it here.
Yeah.
And, you know, again, I think that the goals are similar. I need to get around the grocery store. You know, I still want to be able to cook my meals.
Right, and I think the big thing is too, is that you're coming 36 times, but we end up, you know, you end up being our family. Like we get upset when you end up leaving us. I just had 2 people that graduated, and both of them went to Florida, and they reached out to me last week to tell me how well they're doing. And the one lady, she got a hold of me last night, and she was like, I'm walking around Florida, I'm going to the flea markets and everything like that, and she's like, I know that I wouldn't have been able to do that if it was without you guys. And so we do become really close to our patients. We get worried if they don't come in or don't show up, you know, on certain days, so we're calling you, and what you're going through is what we're going through as well, because we're there with you. You know what I mean?
Why is winter so hard on people with lung disease? Why does that affect the lungs so?
So when winter and extreme heat, so the cold and the heat can really help. Like if you have asthma problems, it helps. It's really hard for you to breathe when you have cold or heat. That's why. And so usually when you're looking at people that are having symptomatic problems, it's usually due to the cold, because that's when you're more getting your colds and your flus and all that's going on, and then your summer because you have all the allergies going on. So that's why.
Erin, this
Yes.
is absolutely dynamic presentation.
Oh, thank you.
Any other questions for Erin?
You guys can't think of anything?
Super, thank you.
Well, thanks for coming out.